Okay, let's dive right into this explainer and completely demystify dialysis. And I want to speak directly to you today, the patient, and your loved ones who are suddenly navigating this whole new reality. Look, receiving a diagnosis of end-stage renal disease, it's overwhelming, for sure. Suddenly, you're just thrust into this world of complex medical jargon, really daunting machinery, and pretty strict lifestyle changes. But here's the thing, understanding exactly what is happening in your body and how these treatments actually help is the very first step toward taking your power back. So today, we're going to use some really clear, simple analogies to translate all that clinical science into everyday language. You know, a diagnosis of chronic kidney disease brings up completely understandable anxieties. In our source case study, there's a 61-year-old patient named Frau Brinkman. When she was told she needed permanent dialysis, she tearfully asked her nurse, "Where is this all going to lead?" And honestly, that is the exact question echoing in the minds of thousands of patients. You might be feeling that exact same fear of the unknown right now, maybe worrying about losing your independence or just wondering how you'll ever adapt to all the new dietary restrictions. I want you to know those feelings are entirely valid. So, to answer that question and ease some of those anxieties, we've structured this explainer into a really straightforward roadmap. We'll cover 1. When kidneys fail, 2. The physics of blood washing, 3. Hemodialysis versus peritoneal, 4. The shunt as a lifeline, and 5. Adapting diet and fluid. Let's get right to it. Part 1. When kidneys fail. Your kidneys are basically your body's master filtration system. They excrete toxins, balance your fluids, regulate electrolytes, the whole shebang. But when they fail, it obviously affects your entire system. Now, your condition might be genetic, like 39-year-old Herr Schoen in our study, who suffered a really slow, steady decline over years due to polycystic kidney disease. Or it might have developed over time, like Frau Brinkman, whose kidney failure was actually accelerated by years of high blood pressure and diabetes. Her symptoms were sudden and severe, fluid building up in her legs, extreme nausea. But whether it's a slow decline or a sudden crash, stage 4 kidney failure leads to toxins building up in the body, which causes extreme fatigue, severe itching, and fluid retention. Basically, both patients arrived at the exact same crucial threshold, even though they took very different paths to get there. And how do doctors know it's time to intervene? Well, they measure your exact filtering power using something called the creatinine clearance rate. To put this in perspective, a healthy kidney clears about 120 milliliters of blood every single minute. But when that rate drops below 10 milliliters per minute, that's when a state known as uremia sets in. That literally means your blood is becoming toxic with its own waste. At this stage, conservative measures like medications just aren't going to cut it anymore. A renal replacement therapy, dialysis, becomes absolutely necessary to sustain life. Which brings us to part 2, the physics of blood washing. I know the dialysis machine can look like a terrifying, complicated robot, but try not to think of it that way. It's simply a mechanical version of the organ you lost, and it just uses basic physics to do the heavy lifting. The absolute core of any dialysis treatment is a semi-permeable membrane. It acts like a microscopic sorting gate that knows exactly what waste to throw away and what vital elements to keep. Think of a simple coffee filter. When you pour hot water over coffee grounds, the filter lets that great flavorful liquid pass through into your cup, right? But it traps all the bitter, gritty grounds. This membrane works exactly like that, just on a microscopic scale. It holds back your precious red blood cells and vital proteins, but lets those tiny, toxic waste molecules slip right through to be washed away. And utilizing that sorting gate, the machines use 4 exact physical steps. First is diffusion, which is kind of like steeping a tea bag. Substances naturally move from where they're highly concentrated, like your toxic blood, to where they're low in concentration, the clean dialysis fluid. Next is osmosis, which uses pressure to pull fluids across the barrier. Then we have ultrafiltration. Think of this as a gentle pressing machine that literally squeezes out the excess water your kidneys can no longer excrete. And finally, convection. This is like a rushing river. As that water gets pushed out, it creates a current that sweeps the really stubborn toxins right along with it. Let's move to part 3, hemodialysis or peritoneal dialysis. So both of these methods use the exact same physics we just talked about, but they apply them in radically different settings. Option 1 is hemodialysis. This uses a powerful external machine at a clinic, usually about 3 times a week. Your blood is actively pumped outside your body into a dialyzer, which is your artificial kidney filter, and clean fluid flows in the completely opposite direction to maximize the cleaning power. Option 2 is peritoneal dialysis, and this is truly fascinating. It actually empowers you to use your own body's natural lining to filter toxins right from your home. It uses the peritoneal, which is the natural membrane lining your abdominal cavity, as the coffee filter. Fluid goes into your belly, it absorbs the toxins, and then you just drain it out. It's a real game changer for maintaining your independence. Part 4. The shunt has a life warning.
Now, if you and your medical team decide that clinic-based hemodialysis is the best route for you, you're going to need a shunt. See, the dialysis machine has to clean your entire blood volume pretty quickly, and normal veins just aren't strong enough or large enough to handle that kind of rapid traffic. So doctors surgically create what's called a seminobrescia shunt. They connect a high-pressure artery directly to a lower-pressure vein in your forearm, basically creating a short circuit. Over a few weeks, it essentially turns it into a super vein. It's an amazing bit of body modification, really. This robust, thickened vessel can now easily accommodate the special needles used for the machine without collapsing.
But because this super vein is quite literally your lifeline, you absolutely must protect it daily with a few strict survival rules. First, no heavy lifting with that arm, so let someone else carry the heavy grocery bags. You need to avoid tight, restrictive clothing or tight watches. You have to protect it from cuts and pet scratches. Honestly, even a minor scratch from a playful dog or cat can lead to severe bleeding or a nasty infection. Also, absolutely no blood pressure cuffs or blood draws on that arm, ever. And finally, wash it carefully and disinfect it before every single clinical puncture. Finally, part 5, adapting diet and fluid. Here's a reality check. Dialysis only replaces about 15% of a healthy kidney's function. That means what you do between treatments is absolutely crucial. And this number, plus 500 milliliters, that is your new daily golden rule. To prevent fluid from building up in your lungs, your allowed daily liquid intake is whatever you excreted in urine the day before, plus exactly 500 milliliters. Because your kidneys aren't making much urine anymore, any liquid you drink just stays trapped inside you. If you drink too much, that water floods your tissues, causing edema, it drives your blood pressure dangerously high, and it can literally back up into your lungs. Oh, and you have to account for hidden liquids too, like the water sneaking around in soups, sauces, and fruits.
To protect your heart and bones, you're also going to need to limit potassium, so sadly, fewer bananas and raw fruit, and limit phosphate, which hides in ready meals and melted cheese. But here's a genuinely surprising fact. Unlike most health diets, you actually need to eat more protein. Why? Because the dialysis process physically washes away your essential amino acids. Now, dealing with constant thirst while on a strict fluid restriction is notoriously tough. But a brilliant little hack: suck on an ice cube or a slice of lemon. It tricks your mouth into feeling hydrated without adding any significant volume to your daily fluid count.
And to give you back some much-needed culinary freedom, modern dietary systems like the PEP concept are fantastic. They allow you to adapt your medication directly to the foods you actually want to eat. It works a lot like how diabetics calculate insulin for their meals. You just calculate the phosphate units in your desired food and take a specific amount of medication, a phosphate binder, right as you eat. It acts like a giant sponge in your stomach, soaking up the phosphate before it can even enter your bloodstream. Yes, it takes some learning and discipline, but it grants you the ability to occasionally just sit down and enjoy a varied, delicious meal. So as you look forward to establishing this new normal, I want to leave you with this thought. How will you use these practical tools to take back your agency and truly enjoy your next family dinner? A diagnosis of end-stage renal disease changes your life forever. There is no denying that. But as we've seen today, through the physics of the sorting gates, the lifeline of the shunt, and these clever dietary tools, it doesn't mean your life is over. It's just a new chapter, one that requires adaptation. By understanding the mechanics of your treatment, you transform from a passive patient into an active, empowered participant in your own care. Thank you so much for joining us for this explainer. Until next time, stay curious and stay empowered.